What does implantation failure mean? Implantation failure refers to a situation where high quality embryos transferred into uterus do not successfully embed and grow into the uterine lining. In context of fertility treatment, is often described as a failure to achieve a pregnancy after transfer of multiple good quality embryos over certain cycles, and the exact guidelines vary, but it seems that three unsuccessful high quality transfers in women under 40. So, what is this in brief the scientific evidence, the scientific risk factors? And if you look at the well constructed trials, they look at the uterine and endometrial factors such as fibroid, polyps, adhesion, septum, inadequate receptivity, inadequate thickness of the lining, disrupted implantation window, infections such as inflammation or chronic endometritis. What is the most important? Embryo related factors. And we think that close to 60 to 70% of implantation failures tend to be genetic in origin. There could be, smaller cases, immune disorders such as antiphospholipid syndrome or thrombophilias causing microclots, abnormal immune response such as NK cell, trying to find them out is more difficult, and hormonal imbalance such as low progesterone or other rearrangements. On the other hand, the sperm itself could be disrupted, such as a very poor quality of sperm or DNA fragmentation, and lifestyle issues such as obesity, smoking, alcohol use, high stress all have a negative impact on natural conception and IVF. How do you prevent it? One is, if this happens repeatedly, then screening embryos is one, doing an ultrasound scan to reassess and see if there are any fibroids or polyps. Then you come to the more tricky situations, such as the immune factors, and which are more difficult to diagnose, and seeing whether adding blood thinning agents would be an option. Finally, looking at tests such as implantation, window screening, and all of these have again limited evidence. And it seems that we still do not know why some embryos would not implant. Equally, managing stress, stopping alcohol, tobacco, lowering your weight, BMI again has an impact, improving sperm by taking antioxidant and interventions. And with all these, we seem to still have around 10% to 15% recurrent miscarriage rates with all the possibilities arranged and planned.